So this is the NUR203 Pediatric Nursing Exam 1 review. We do have the PowerPoint. Did everybody have the PowerPoint that was sent to them?
I'm so sorry. I'm trying to juggle everything. Which PowerPoint, the
And
exam
it right
preparation,
here,
was that in
right
the,
there.
I think I have that one.
That
Okay.
is the PowerPoint that it is. Now, as we're going along, and if you don't understand anything, please do not hesitate to stop me. I've let my students know I don't mind being stopped. It doesn't bother me. I don't get agitated. I don't get irritated. Not much irritates me. So if you have a question, I'm sure somebody else is thinking the same thing. So we're going to start out first with a theorist, and then we're going to be working it into the rest of the PowerPoint, okay? So Erickson, we know that there's infant, toddler, preschool, school age, adolescent. Those are the 5 ones that you need to know. So there's a lot of different slides on it, but I'm just going to use this one to discuss it. So Erickson is a theorist that looks at children and looks at their psychosocial. Means how do they deal with the world? Okay, that's basically what it means. Now, an infant, what are their needs? What do they want? What makes them feel good? Well, if they're fed, if they're burped, and if they cry, mommy comes, somebody comes, picks them up. And that is what we call trust. Now, this gives them, they're a happier baby, they're secure, and you really can tell the difference in an infant who does trust. Now, what is mistrust? Well, there are times where parents or whoever watching the infant doesn't pick up an infant right away. And I'm not just saying once, I mean consistently. When an infant's needs are not met, which means being picked up, being fed, being changed, being burped, that is mistrust. This infant will come to the point where they'll stop crying because they know nobody's coming. So trust, my needs are met, somebody comes when I call. Mistrust, I'm left there alone, for my own. Now, when I get to your toddler, remember, toddlers are all selfish. They're all about themselves. They're automatically mine. That's the autonomy. That's how I want you to remember that name. Autonomy, automatically mine, me, and that's all I care about. And that is a toddler. And we know that toddlers love to explore. They like to do things themselves, feed themselves, dress themselves, go potty by themselves. This is all toddlers. Now, what is the shame and doubt? Well, parents and people that are around these young 1 to 3-year-olds, that area, they say that they're watching them to protect them. And sometimes you will hear the parent or the caregiver, be careful, don't do that, don't jump, let me help you, let me put your shirt on, let me feed you. It means they don't let them do what they're trying to do. And then they feel like, hmm, maybe I can't do that. And they start doubting themselves and their abilities. It's important that we teach parents, let the child try. Now, I'm not saying let them try to jump off of a couch onto another couch they can't reach and they fall on their head on a tile floor. I'm not saying that. I'm saying those little things, let them do, let them try. They need to do it in order to feel that sense of themselves. All right. So, autonomy versus shame and doubt. When we get into preschoolers, now they're starting to think, they're starting to take the initiative to maybe help mommy, to know that in the morning my jammies come off, clothes come on. They might go ahead and do that. But sometimes they don't make the right decisions and or didn't do it correctly, which, come on, this is a preschooler, they're going to have that trial and error, right? But they feel guilty. So the initiative is Maybe saying, getting dressed in the morning, or helping mom set the table, or clearing the table, or going outside and get some potatoes for mom, or whatever, helping. That's the initiative. The guilt is when they don't do it right because they want to do that right and that they hope that their decisions were good. Now, when we get up to your school age are children that have an industry. What is an industry? That's my house, my factory. It's what I produce, and I produce well. That's my product. Okay. What is my product? Well, I'm good at swimming. I'm good at math, but I'm not good at, English, or I'm not good at hitting a ball or running. So my industry is those things that I feel good about. I play the piano well. I can cook well, right? That's my industry, my house, what I produce and do well. The inferiority is the stuff they can't do because most children want to be able to do everything, right? So when you look at these serious questions, remember the names of the stages and then the ages of those stages, because you might get a question regarding, let's say, a 9-year-old is in the hospital for blah da 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 da. What is the stage of Erickson? Would you think? Well, all of it's the blah blah blah, except it's an 8-year-old. Who is an 8-year-old? That is that industry versus inferiority. So those are ways you might use this. Identity versus confusion, your adolescence. Well, think about you as an adolescent. It's a very confusing time of life. It's where you're trying to figure out your sexuality. Who do you like sexually? Or what am I going to be when I grow up? And what college am I going to go to? Or what group of students do I fit in with? The band group, the art group, the drama group. These are all part of making their identity. And because it's so frustrating and you make multiple different changes trying to figure out who you are, that is the confusion. Can you imagine as a adolescent, you got to figure out who you're going to be when you grow up and start that track, right? So Freud. Freud is all psychosexual, anything to do with sexual type stuff. Oral, anal, phallic, latency, genital. What do those things mean? Well, as an infant, how does an infant draw pleasure? How do they self soothe? And it's all through their mouth, whether it's a finger, whether it's a pacifier, a rattle, a blanket, whatever, in the mouth, oral stage. And they really do soothe themselves that way. Now, anal. Anal is that where we're starting to potty train, okay? Just check one thing to be sure here. Right. I had a moment. So, anal is all about toddlers and potty training. And the reason why it's anal is because bowel training is always first. They can feel it easier. We know they're ready for potty training when they're dry for 2 hours, their urine, but we know that the bowel is first. So, anal is potty training. Now, phallic is all about boys and girls and mommies liking, girls liking daddy and boys liking mommy. It's all a part of that in understanding their differences. Latency, and why is it called latency? I don't know. But Freud says that as a school age child, your friends are your same sex peers. And that's all that means, that they do prefer to spend more time with same sex. It's not the opposite sex yet that they, hang around with, very rarely. And then the genital is now, of course, their hormones have kicked in as an adolescent, right? So they're attracted and they're doing all the exploration with their genitals.
I have a
Now,
question.
sure,
Sorry, I
go
have
ahead.
a question on the latency. I was reading on some different charts that the latency is like they kind of care more about friends and family, and it's kind of like a stagnant stage almost. Is
They
that
are pleasers. They are pleasers. They
okay?
want to please. They want to do good, which is actually from the latency of Freud, also the same similarity as Kohlberg.
Oh, okay, okay,
But the big thing is same-sex peers. That's the big difference in the Freud. But thank you.
okay.
Very good. Yes, absolutely. It is that, you're figuring out who you are stage.
Thank you.
You're welcome. No, thank you. So Kohlberg is all about morality, which means what's morality? Right and wrong. Now, initially, the younger children don't understand. The infants, toddlers, they don't really get it yet. It's when they get into the preschoolers that they're understanding that there's good and bad behavior and there is a consequence. But they determine that as punishment and reward. That's the difference of the preschoolers. Now, as they get older, as I said, they become those who conform to the rules. They want to please, they want to be the goody person, right? It's all about because they know that's a better way to be on that school age. And then when it gets to adolescence, it's not about how they do right and wrong with themselves and others. It's the society now. If they're driving a car, the light turns red, they stop. You know, certain behaviors that society does. What's some other stuff? Open a door for someone, the older lady to let her through the door. Um, it's just those society behaviors that we do, which are good things. You don't steal, you those. I can't really think of any more right now, but it's what society says is good and bad. You're not going to get, the police or insecurity going to be called, all of those things, doing right. Now, Fowlers. The way we discuss Fowlers and the way to discuss it in exams is all about spirituality and our children and family. We know that we have our own beliefs, and that's good. You need to know what your beliefs are. You do not need to accept or understand your child or your family's beliefs, but you need to give them that opportunity to practice that religion, that spirituality, as long as it doesn't interfere with the medical care. So you first start examine who are you? What do I believe in? And then letting that child, when you know their background and what their requirements are, is it, like they pray 6 times a day. So knowing that at this time, this child will be praying and trying to put your routine around that. And that's what we're talking about when we talk about Fowlers. Now, Piaget is all about thinking. And as I said, infants come out and they don't even barely know how to breathe, right? And then we hit them on the butt and when they choke and gag and then they breathe. And then we put something in their mouth and oh, they start to suck on it. And then we put a rattle by their hand and the reflex, they grab it, right? And then they move and oh, it makes a wiggle. So they've gone from not knowing how to breathe now, they can do a rattle. And that's a lot of cognitive awareness. They've really matured and understood how to do that. Okay. It starts with sensorimotor, which is just the touch, the mouth, of course, and the movement. And then it goes into this fantasy, as in animism, where they fall down on the steps and they yell at their steps saying, "Why did you trip me so I would fall on that?" Or why do trees have leaves? And it's to keep them warm or to keep them from getting wet when it rains. I mean, these are them thinking. It's the broom that's now a horsey, or their arms out flying around. It gets now they're starting to think more and relate different things. Now, as they get older, there are some changes that go on school age and adolescence. Now, school age only understands concrete. Concrete, they can see it, touch it, feel it, smell it. They've seen it, heard it before, and then they could use that as their thinking. Remember, this is all cognition about thinking. That school age, they've had to see it before. The concrete, they need to see it. Now, adolescents, the difference is they can make a whole bunch of stuff up and never have seen it before to fight their way out of a paper bag and get what they want. And that's adolescence. This goes into a lot of them. I told you there's a lot of different pages on them, but it's exactly what I just said to you, okay? In a very more simplistic way. So play, you're going to see play. Play, what do kids do as soon as they wake up to the time they go to bed? If they're not eating, they're playing. So what are the types of play? Onlooker, they're looking at somebody play. Oh, I like the color of that toy over there. Let me see what's going on. Solitary play, playing alone. You see a lot of solitary play with your autistic children. They like to play alone. Parallel play, think toddler. Okay? Toddlers, that's the only play they know. They don't share, do they? And if somebody has a toy and they try to grab that toy at another child's arms, it's not going to go well because they are selfish. They want their own toys and they don't share. So parallel play, couple kids next to each other, but they're not sharing, but they're just playing in the same area. Now, associative play is two or more children playing together, but there's nobody who wins. They don't create things. And that is preschoolers, all right? They're not to the point where let's go ahead and make a house. That goes into your older children, your school age, which is cooperative play. So, cooperative play, there's no end result. You know, they didn't make a tower, they didn't play a board game, nobody won. Cooperative play, that means there's a goal, something they're working forward to, whether it's that board game winning or it's building a castle, putting together a train track, whatever it is, that's cooperative play, school age. We know cultural differences. I mentioned this a little bit, you know, with Fowler's and religion. We know that something that we understand a little bit about to take care of the child. It could be a difference in diet, could be a difference in who takes care of them. There are some cultures that are vegetarians, some that don't eat pork, some that don't eat meat. I mean, there's all different things. And if we're going to take care of the kid, we need to understand what their diet can be, right? There are cultures that if it's a girl, they don't want a male nurse. It's part of it. What about those who are always covered? And, you know, even their heads are covered. And we have to do an assessment. We don't ever just take all the clothes off. We only remove the little pieces we need to get underneath to listen. And that's out of respect for their culture. Okay. And how do we learn this? And how have I learned it through the years? I've just asked. I asked a parent, is there anything I need to know that I can incorporate into the care so that you're getting all of your needs met? And I want you to know parents are grateful if you ask. It's not like you don't know. You don't have to know everything in this world. The thing is just to ask that question, right? And again, make sure you know your own spirituality. That is the most important. Assessing a child. Never, ever, ever, ever head to toe. That's adult world. Children, number one, how do you get to them and how do they get to trust you that you're able to do an assessment? Well, never, ever sit above them. As I have always said, I pull up a chair and I sit a little bit below them. And then I get on their developmental level and break the ice. Maybe it's stickers. Maybe he's talking about the cute t-shirt they have on, or their freckles, or their curly hair, or whatever. Just breaking open the ice. Once you get there, you can let them explain what you're going to do, let them touch all the instruments, and it will go really smoothly. Just taking a couple of minutes in the beginning. Now, infants, little children that are asleep in mommy's arms, oh, this is the prime time to listen to lungs and to heart sounds. Um, because when they're awake, they are cooing, they're moving, they're wiggling. It's really hard to hear heart sounds. And sometimes, the breath sounds because they're moving. As we're doing that alert child, it's always from least to most invasive. As in the last thing I'm going to do is a blood pressure because it squeezes them, right? So that would be one of the last thing. And then I'm having them pushing the button on that machine, get them involved in it. Always as you're doing assessment and histories, make sure that we always remember your job is to protect this child. If the story that they're giving you doesn't match the injuries, be suspicious of child abuse. And I have seen it several times. And again, maintaining professionalism, reporting it to the doctor, to the charge nurse, and then making sure that child is safe. That is your job. One of the things that we tend to forget, especially when a child comes in with somebody sexually abused my child, the neighbor, the nephew, the whoever it is. Remember, parents are bringing their children in for sexual assault. Don't forget that parent. I can't imagine that feeling of, you're sick to yourself because something happened to your child and you couldn't protect them. So always remember the parent there, okay? Another condition is called Munchausen syndrome. And this is when the caregiver intentionally is hurting their child. And it's not really obvious. This kid is always sick. They do things like they might have an open wound, they might put dirt or things in it to keep it dirty, or they might take stuff, stool, urine, and inject it into IVs. They're all crazy stuff that they do. Oh, yes. It's crazy what they do to keep their kids sick. Now, if you suspect because this kid's always in and out of the hospital for no reason, like what's going on now, never let that whoever the caregiver is in the room alone. Now, they don't need to be supervised 24 hours a day, the child. But when the parent is there or the caregiver, make sure somebody is in the room with them. And if they bring anything in, the food and stuff, because they put stuff in the food, make sure that you examine everything. Okay. Mush housing. So growing up, well, I've said it 100 times, we'll say it 101. Nutrition, nutrition, nutrition. If your child is not eating, they're not going to advance the way that they should. Now, one of the things that you need to understand is the weight. So every time a child goes to the doctor, ER, urgent care, we do a height and a weight. And we do that because we're looking for nutrition, or maybe why the child is delayed. We can say, oh, it's nutrition. They're not gaining enough. So, infants, first year, double their birth weight by 6 months and triple by 1 year. And it does not quadruple till 2.5 years. But knowing those things, especially that first year of life where they're doing so much, right? Now, if they're too little, let's say 6 pounds, they're born at 7 pounds, and at 6 months, they only weigh 10 pounds, they should be 14. What do we need to do? Well, you got to figure out why. And probably we're going to increase some calories. One of the things, the way that we measure nutrition, whether they're young or old, is that 24-hour infant intake diary, right? It shows you how much did they eat. And I always tell them, give me a wet diaper or stooly diaper. Let me know what's going on. So if their weight is low, we can increase calories. The weight is high, we can decrease the calories. And we've seen both of them do need correction. Now, in nutrition, there is your BMI, which looks at your body mass index. It is the most accurate way to do your dosages for medication, but we only do milligrams, micrograms, units per kilo. We don't go into it that far unless it's, some of the chemos and that whatnots. But generally, this is all that we do. If we're looking at the BMI, we're looking, are they big? Are they small? Are they normal size? That's all we're looking at. The numbers that you need to understand, 85 percentile is you're at that. It means you're big. That means you're at a risk for being overweight. But once you're at the 95th percentile, that is considered obese, overweight. Okay. Again, when we're looking at nutrition, looking at adolescents, remember this is the age where they feel like they're too fat, they're too skinny, they're too this, too that. So if we're seeing these different numbers, how do we monitor and figure out what's happening? Again, food diary. Any age child, problems with nutrition, food diary. Developmental assessments are done to
I
make sure.
apologize.
Sure, go
I'm
ahead.
so sorry. I have a question on the BMI.
Sure.
So for BMI, that formula, will we have questions on the test? Like how do we calculate a child's? Okay, just wonder.
No, you do not. But you
Okay.
need to know what the BMIs mean, those higher
So,
ones mean, and
so
that
the
you would
85th is the average
85,
score,
right?
and then
85
95 is.
is, yes, yes, very good. Absolutely. So, no, no problem. So, developmental assessments are looking at the way that they're walking, talking, moving, all of these things. And if they're not where they should be on that curve, whether gross motor or fine motor skills, we know that we can institute early intervention. It's the reason why we go ahead and we do these little assessments when we see our children, because the earlier that we introduce it, the better they do. And there's all sorts of programs, and there's one written here with the early intervention, early steps. And it does, it helps. It gives them the care they need, and also decreases costs for parents. Now, cardiac assessment. These are the areas where you would do a cardiac assessment. Now, we bring it in here. It's going to go back, and you're going to see more cardiac in the week 5, which is pulmonary and cardiac. But these are the areas, again, looking at them. When you get to capstone, you're going to have to do your simulation, all your where all the valves are. So again, this is just another way to look at it. Now, the aortic, pulmonic, mitral, tricuspid valve. Well, where are they in the heart? And that can figure out, and just reading the areas, you can do that too. But one of the things, again, heart sounds, we can hear if there's a different sound. And then we can go and look for the valves after that. I mean, a murmur would just be a washer machine. Now, now. It's, a different than chikunk, 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 right? It's a different sound. And again, if an infant is asleep, that fourth intercostal space, left side of the chest, is your great way to measure an apical pulse. I mean, getting an accurate apical pulse would be extremely important on maybe that child who's cardiac on digoxin, right? So that's why you need to know that. Breath sounds. Children are a little bit different. They tend to have always this upper airway mucus. Oral pharynx is full of mucus, nose, always. This is children. They don't blow their noses as well, and it doesn't bother them like it does adults. But there's different ways to look at it. Now, the bronchial breath sounds are right at the tracheal, right at that little hole right here between, that notches between your clavicles, right there. Now, in a child who's not breathing well, you're going to see that be pulling in, and that's where we'll be listening to where the bronchus, breath sounds, what's in there. Bronchial vesicle is the upper airway that we'll be looking at. Vesicular is where we listen to the lungs. Are they bronchi? Are they rails? Now, one of the things we hear all the time on children is adventitious sounds. And this is upper airway mucus nose making this bronchi sound, but it's really, we listen to the bronchial area, we know it's upper airway. It's not in the lower. And that's why we mention where to assess sounds, because just listening to the breath sounds, it could sound like rails and bronchi, and it's only they need to blow their nose. Car seats, we know the general rule. Infants up to age 2 can sit in the back seat rear facing. You need to take that harness wraps that they have now, those straps, make sure they're snug, and then using blanket rolls, especially your younger infants when they're just coming out of the hospital. You got to sort of roll them up into blankets and get them really set right into that seat, and that can work. And then after age 2, you can turn them around and put them front facing. The one thing we need to remember about car seats is that they do expire. So using one on your that you had for your 8-year-old daughter, you have a newborn, may not be the best of choice. They expire, and there are dates on car seats. So infants. Now, growth and development. There's a lot of stuff here. Why do you need to know this stuff? Well, again, we're going to be looking at development. Are they going the way they should, or do we need to investigate why aren't they holding their head up yet? Why aren't they rolling over yet? So, head lag is when the head falls back when you pull them up by their arms. And the head should be coming up with the arms by 3 months. And if at 7 months the head's still falling back, there's something neurological going on. The neck muscle could be something going on. Again, it needs investigation. And as I've said over and over again, kids, when you give them early intervention, catch up so quickly, but they need that extra therapies to get there. So they need to be on their back for sleep, right? We never put them on their tummy. They can roll from their abdomen to their back at 5 months, and they go from their back to their abdomen at 6 months. So by 6 months, they're rolling over. So if by 8 months, they're not, problem. When they're on their backs, they're going to put their feet, hands, everything in the mouth. We know everything goes in the mouth. They have first the reflex grasp, then it goes into voluntary, and then it goes into the crude pincer, and then it's the pincer, right? It's all about fingers and moving them. Teeth usually start at 6 months. It does not mean all children have teeth at 6 months, but usually the earliest is at 6 months. At 9 months, they can pull themselves up, and at 8 months, sit unsupported. That's a big one that you see a lot there. And of course, by 12 months, they should be attempting or they should be taking steps. They should start to walk. Colic is gas. And this is a infant who cries more than 3 hours a day, more than 3 days a week, more 3 weeks, and it goes away. Oh boy, 3 to 4 months. These parents are exhausted. This kid is always crying, and you can't get them comfortable. One of the things is, how do we take care of them? We could teach them how to burp them, how to feed them, how to sit them up, put them on some gas drops of some sort, and they still are going to be having garlic. It can happen no matter what, whether you're breast or bottle. There's no difference in this regard right here. One of the things about assuming things in infants, especially the young infants, don't ever assume that if, let's say, a mother calls you, you're at a doctor's office or an urgent care, they're calling. My baby's been crying like 8 hours a day and I don't know what to do. Can you recommend me something? Well, you can recommend them. They need to get into the doctor and see them. Because remember, there's no immune system at these young ages. It could be something more than just colic. Don't always assume that that's what it is. All right, there's different stages: sequential, developmental, and there's sensitive period. Sequence means you lift your head before you roll from your belly, before you crawl, before you stand and creep and walk. And that's just the sequence of growth and development, right? Developmental pace is when do they do those things? They do it at their own time. There are some children at 1 month, their head is up. And sometimes they're rolling over by 4 months, not 5 months. They're just going in their own way. Also, they can go from not rolling from their abdomen to their back, they can go directly from their back to their belly and standing up. They can skip stages, and that's okay. It's their own pace. They're doing it at their own time. Sensitive period are those times where they start learning things, their language, their movement, and these are things as parents teaching them, and encouraging the child. That would be your sensitive. So the soft spots in the head, you have the one in the front, anterior, the one in the back, posterior, and they close at certain times. Why do you need to know when they close? Well, what if the posterior fontanelle is still open and the child is 4 months old? Well, there's a problem, right? It didn't close. Is it because there's hydrocephalus in the head and it's creating it to stay apart? Is there a brain tumor in there? Same thing with anterior. If this isn't closed, or if it closes too quick, can the brain expand and grow the way it's supposed to? So, both too soon, too late are both something that will need to be evaluated. Binocularity, I love the middle picture, that cross picture, because that's what the eyes do. They work separately. They don't, like when you put your finger out, both eyes will go to the finger and you've got depth perception. With binocularity, each eye works its own way, and that's why they have that cross-eyed sort of look. So by about 4 months, they should be working together, and then by 12 months, their vision is almost normal and they're getting, as they get older, better and better depth perception. So, pain. What do you see? An infant in pain and young kids, they're going to cry. Their face is going to crunkle up. That little chin is going to start quivering. Usually the eyes are closed. And then you're going to see them thrashing, or you're going to see them not moving at all because they hurt so bad. Okay. So we need to evaluate, all right, what's going on here. I mean, if the kid banging their head, could be an ear infection. Hands down the throat, could be a throat infection because they can't tell you. Young infant, they can't tell you. So you're evaluating the pain and medicate appropriately. How do you medicate? Medicate could be as simple as acetaminophen, and that's the only thing we have for the first 6 months of life. And then after that 6 months, we can start the ibuprofen. Also, remember, one of the best things to use for young infants in pain is a pacifier with sugar water on it. It works like morphine. And as I've told my class, there was a study by a Harvard neurophysicist, I believe, or psychologist, one of those people, but from Harvard. And what they evaluated was the effects of morphine and the effects of a pacifier with sugar water, sucrose on it. And they saw no difference in pain control. So that oral self-soothing works really well. You're drawing blood on a young child, give them a pacifier. You're doing something that could hurt them or they're scared about, give them a pacifier. It is a self-soother. So SIDS death, something that we've been looking at for the last 25 years that I know of. And what they found out is that children who sleep on their back do a lot better, have less chance for SIDS death than those on their sides or their tummies. They just get into that bedding and they sometimes spit up a little bit and they will die first year of life. So how do we take care of these and what are these risks here? Well, no loose bedding, soft bedding, no blankets, bumper pads, no bed sharing. And I've seen actually a larger father roll over on his baby during the night and suffocated his baby, with himself. So no bed sharing. Another thing is just having that kid too much clothes on, too much blankets, whatever, overheating. Absolutely no smoke should be around infants. That does do it. Of course, if there's little or no prenatal care, younger mothers, premature babies, and male infants, the infant who has the least chance actually is the breastfed. Formula fed infants have a higher risk. So that's usually one of the things that has a parent, a mother, decide to breastfeed.
Why do you think that like, because I'm one of those moms, my milk never came in ever with
Yeah.
any of my kids. And I remember feeling so worried about SIDS because, I read about it and that was one of the risks was formula feeding. Why do you think that formula fed infants are more prone to SIDS?
Well, think about what breast milk is. You are giving a constant immune system to that infant through the milk. So they have less chances of being sick.
Okay. Okay, that
So
makes sense.
it's increased in formula. It is an increase in formula there.
Oh, okay.
So reflexes, the ones that we talk about, a step reflex. Have a baby stand up, their legs are going to go like they're walking, right? Of course, the crawl, the grass, we've gone where it is that um, reflex and it goes into voluntary. Moral is when a baby gets scared or you hit the crib, their hands and their feet just fly up. And that's the moral there. Babinski is the same as your adults, same sort of thing. And rooting is when you touch that little side of their cheek and the baby goes for it, as in for breast or for bottle. So those are the couple of reflexes. Babies, when they go to fall, tend to be like a cat, right? Hands and feet come up. Or if you're turning them over to put them in a crib, you'll see their hands and their feet come up. And that's usually about 6 to 9 months. It's a protective thing. And you never lose that. It's just part of you're going down, your hands and your feet are coming up. Nutrition, nutrition, nutrition. For 6 months of life, human milk or iron fortified formula. That's it, nothing else. Anything else is not going to be absorbed into the body, and it's just a waste of energy and calories to try to dissolve and to get that food that we can use it and still going to come out in the stool. So only breastfed or iron fortified formula. What they say is 8 to 10 minutes on each breast, and you know that they're getting enough food because it's always a question with parents is at least 6 to 8 wet diapers a day. And many times with breast, it's a lot of stool in it, and that is absolutely normal. Babies lose weight at first, up to 10%, because of that extracellular fluid that they have, and they lose it. It's normal. And then all of a sudden, they'll regain their weight within 2 weeks. So it's the first week they lose it. By the second week, they're back up to their where they were born at, and then they're going to gain about a half an ounce a day for 2 months. Breastfed infants do get vitamin D. It's just part of what they need with the breast milk. Now, the second 6 months, we're going to start to introduce food. We know even though it's 6 months, the GI tract is more mature, it's still, you still might see, something in the stool, peas or beans, or you might see little pieces. Absolutely normal, but it's because it's going to take a while longer to be completely mature. So that's, at this point, it's okay. We're going to do one food at a time, 4 to 7 days apart. And What we're doing one food at a time for is looking for any allergies to the foods. It could be a rash, it could be vomiting, diarrhea, it could be colicky, gassy pain. Um, if it's just a simple rash, it's easy. We can figure it out. But it's something that we do check for. At 1 year, you can wean them from breast and bottle and put them on whole milk. Now, not all parents do. It is a personal decision, but you can at that point start it. And they also say that another dairy alternative when you get to 6 months is a soy-based yogurt, which is again starting a different sort of food, a different sort of texture. Immunizations, we know that the first one is Hep B. It's given within 24 hours of birth, usually, and then they get another one at 1 month to 2 months old, and a third one when they're 6 to 18 months old. So this is something that we do start with. Um, Another one of these things is influenza is not given till 6 months of age. And remember, influenza is a virus, okay? Now, many times we need to give 3, 4 different sort of injections at the same time. And I know some parents are concerned because these are needles in their vastus lateralis, right? And they're concerned about pain. You can use a topical anesthetic for there. Also, what else would you do? Give them a pacifier with sugar water on it, and that's going to help with pain. They also say when they're done with the immunizations, do bicycling of their legs and even cool packs if they're getting warm, those areas. It is not uncommon to run a fever a day or two after immunizations. The body is just making antigens and making that immunization workable so it can be used in the body and protect them. And that's the schedule from your book, just for you to look at. When does the head and chest circumference become equal? They're born, their heads are big, right? And then all of a sudden, about 12 to 15 months, the chest should be equal to or bigger than the head. Now, toddlers, as I said, trying to get up to them, do an assessment is difficult. So go below them. Don't tower above them. And again, open up the conversation developmentally appropriate way. Always remember developmentally appropriate. You start with hands and feet and then you go inwards, okay? As in least to most intrusive, and give that child to that parent. Absolutely. That's where the kid feels comfortable, secure, and less fear and stress on them. Okay. Also, be very slow. Don't try to do everything in a minute. It's not going to happen. And if you try, the kid's going to get scared. And I always let them feel the equipment, touch the equipment, push the buttons, whatever I need to do after I've gotten on their level, after I've done, open myself to them developmentally appropriate, and now they're going to be involved. So, pain in a toddler. So, from infants through toddlers up to age 3, you're on a flax scale, which is looking at faces, legs, activity, consolability, and crying. What do you see in a toddler? Now, sometimes they don't realize how to express what they're feeling, but you can tell. A kid sitting in the corner refuses to play, doesn't want to eat, there's a problem. Something's happening. I mean, if we see crying that can't be comforted, I mean, we understand that, but it could just be not wanting to play, not wanting to eat, or not even wanting their favorite juice or whatever it is. So with flax, we're going to be given some something that will be, it could be acetaminophen. But remember, it's not just medicine. It's the whole picture we got to do. So you've got a kid, you've given them something for pain, you've given them that acetaminophen, and there's other stuff. We can, if they're in bed, we can sit them up properly. We can, older kids, even the 2 years old, and they had something done with their tummy, give them a little pillow to hold their tummy, put on the TV, put on cartoons, give them stickers, distraction, distraction, distraction. Music actually is an amazing distraction that I used a lot in the newborn ICU. It works well. And remember, hot packs, cold packs, whatever it takes along with the medicine, okay? Again, we know pain medicine, sometimes we have to give morphine for some of these pains in an injection. Um, if we can, try every other route first. But if we have to use an injection, make sure that we give, something to numb the pain so that, or distraction of the pain so that they're not going to hurt. And again, that could be that pacifier also. Toddlers, everything slows down. The weight slows down, the height slows down. As I said, birth weight is 2.5 years, it quadruples. Again, the head, the chest is going to be equal or more chest than head at this point. And toddlers are in what we call a physiologic anorexia, which means you had this infant, 12 months old, eating like a crazy person, and you couldn't feed him enough. And then all of a sudden, about 18 months, they don't want to eat. They don't want that. And they're eating these little pieces of stuff and not eating as much. It's absolutely normal. They don't need as much because look, they're only gaining 4 to 6 pounds a year. The first year they went from 7 pounds to 21 pounds. That was 14 pounds they gained. So they needed a lot of food. They don't need it now. Their gross and fine motorment becomes more and more coordinated. You have improved manual dexterity. You can throw the ball. Um, Part of their play, as I said, parallel. They don't share. It's all about themselves. They play next to each other. It's not uncommon for a kid to have another child take one of his toys and they go back and snatch it back out of him because that's my toy. It's not an uncommon fight. By 1 year, they're in one word sentences. Mama, dada, nana, whoever. By 2 years, now they're talking more word sentences easy, getting their points across better. And again, as I said, they're starting to feed by themselves, play by themselves, dress and undress. Potty training, this is, all the anal stage in Freud, right? They do need to have 3 signs of potty training readiness, which is basically here. It's, they understand their stool and urine, and they want to please. It's part of it also. They want to please their parents. They say bladder, they have to hold the urine for 2 hours, then they know they're ready. But as I said, it starts with bowel first. Injury prevention, again, toddlers into everything, that intense exploration, that no, me, mine. Um, and again, we have to protect them from injury, but remember, it's that autonomy versus shame and doubt. You can't like overcorrect them. You need to let them try a little bit, right? They do have temper tantrums. Normal, normal, normal. Now, best form of discipline is timeouts. 1 minute per year of age. Another thing that parents should have, especially with toddlers, because they are exploring the world. And how do children explore the world? In their mouth. So make sure they have poison control number there. Preschooler, again, they're slowing down. They are picky eaters, but they're eating a little bit better. And there's certain foods that they will not eat. Kohlberg and this child, this preschooler, what you need to know, it's reward and punishment, okay? And they're starting to understand other people if they're hurt, like kiss it, make it all better. When my knee was hurting and my grandson came up, I believe he was just around 3 at the point. And he gave me a kiss on my knee and says, "Okay, Nana, all better." And they're starting to get that. It's the age of band-aids. Why is it the age of band-aids? They feel if they're cut, their insides are going to come out and it's all going to go away and they're going to die. Because remember, they're into death at this point. They're into dead and dying. Band-aids fix everything. And of course, it's like that little girl has down there, all of these cartoon band-aids they absolutely love. Another thing about illness in the preschooler, if they get sick, they hurt themselves, they feel like they're being punished from God because they did something bad. It's just part, and nobody teaches them that's just the way that they are. Now, preschoolers, ages 3 to 8, this is when we can use these scales. Um, I say to 8 because your next scale in the book is numeric and it says age 8. Okay. And I'm telling you, they can look at those little pictures and they will point to the one that they hurt. And unlike adults, children tell you honestly how they feel. Gross motor skills, look what they're doing. They are running, jumping, riding a tricycle, throwing balls, hitting balls, all of that good stuff. And here delineates the ages. Ages 3, walk on a line, skip or gallop, pedal a tricycle, catch a ball, jump with 2 feet. By age 4, they're standing on 1 foot. And it's funny, before that, they try and they fall over. They can't. And then all of a sudden they can. They can get on their tippy toes for a couple seconds, hop on 1 foot, jump onto a step, jump over a hurdle. And then they run and they could go back and forth and all over it. And they're much more agile right there. Remember with preschoolers, motor vehicle related injuries increase. And why? Well, it's not necessarily that they're in the car getting hurt, it's when the car hits them when they're outside. Because they're outside, they're playing with toys, and even in parking lots and whatnot, they are hit more, or in driveways more. I've seen several in my career, preschoolers that were ran over by a car in their driveway, by people they knew. It was just they ran over the kid. I've seen okay outcomes, good outcomes, and not so good outcomes. By age 6, they're going to ride a bike, jump a rope, and play hopscotch. Again, age 6 is getting into that school age. So, what is school age all about? It's all about what they do well, their industry, right? And the thing about this, another way to look at it, when you give a school age child something to do, make sure you give them something that's challenging, but that they can accomplish. And that will make that their industry. You always do that with school age children. So don't give them something that there's no way they can do. Give them something that with a little bit of help and a little bit of thinking, they can. Fine motor, what are they doing? They're threading blocks, they're playing with toys, they're coloring in the lines, they're buttoning their shirts, and then getting ready for school. So preschool age, there is preschool, yes. And we're trying to get them ready to go into kindergarten. And going to kindergarten is now away from the family, another adults taking care of them. They have to sit, pay attention, and they need to do what they tell them to do, perform the task, write the whatever, read the whatever, color what the ever. So this is preschooler, and parents should be promoting a positive attitude towards learning. One of the biggest things besides that, helping them with their language and their colors and all that is also to read. Reading every night is actually a great time for bedtime. It calms them down. It reads and it puts them in a nice little magical world, and it puts them to sleep nicely. Another thing, with preparation and what adults should do is there's no more baby talk. You need to talk to the child, with full language, full sentences, and words that they can learn from, not over their developmental level, but again, it promotes them a good language to use. Communicable diseases, one of the ones that's always looked at is chickenpox, varicella. Chickenpox, varicella, and you say, "Oh, there's an immunization." Well, they still get chickenpox with an immunization. And as a nurse, and I did my last 10 years as an emergency room nurse. And as I've told most of you, I am that nurse who has an autoimmune disease. So I am more apt to get, things like this. So if you see a child that has a rash, an itchy rash, low grade fever, this is something that you would put an N95 mask on yourself and put that child in what we call a negative pressure room. And all that means is the air from the room goes through a filter outside. It doesn't come back in the hospital because other children could get it too. Now, usually, chicken pox, we know that they're contagious before they break out with a rash and all of the mapules and papules there, but they're also contagious until all the lesions are crusted dry, and then they can go back to school. Neglect, abuse. I've mentioned a couple things with it, but remember, neglect is when they're not getting their child's needs physical, emotional, educational. And remember, our job as a nurse is to protect the child. And you always suspect, and this is the big one, that the history of what happened and the injuries, they just don't make sense. It is not. And again, sometimes you can get the child away from the parent, and then sometimes their stories are different. That that would be a real red light going off. And remember, if you have again the parent who's there, make sure that in some cases that you support them too. I mean, we think that the parent who brought them in is usually the abuser. Not all the time. Sometimes yes, a lot of times no. Just know that, well, for instance, like I said about the sexual abuse, remember the parent is also needing you also part of that family centered care, right? Nutrition, these are the calories we need 1,200 to 1,400. We need protein 13 to 19 grams. And remember what things are good for as we're talking to parents. Protein does what? It does muscle growth and good wound healing. A child who's not getting enough protein has a wound. What would you do? Well, you're going to increase the protein in the diet. That's going to help with healing, right? Another thing is some children, let's say they're iron deficient anemia. Well, again, remember with nutrition, we can change the nutrition and give them what they need. If it's iron deficient anemia, it's all nutrition related. So what would you do? More green leafy vegetables, eggs, put meat in their diet. School age children, ages 6 to 12. Starts with the beginning of their baby teeth coming out, and it ends school age with their final permanent teeth in. Again, it's very slow, gradual growth. We know that they're becoming more and more aware. We know that um, Piaget talks about conservation, and it's the idea of, let's say you have a dime and you have a quarter. Um, you have a dime and a nickel. That's the better one. You have a dime and a nickel, and we know the dime is more money than the nickel. The younger kid will say, no, the nickel is more money because it's bigger. Well, as school age children is more aware. No, it's the dime because that's 10 cents, not 5 cents. Younger kids don't get that. Same sex peers with Erickson. And then again, Kohlberg, pleasing others. We know that there's not much difference between boys and girls and their growth. And it's still slow per year. Over 6 years, it's quite a bit. Injury prevention, know that motor vehicle is always number one. All right. Know that water safety is very important. especially if you live around water. I mean, me living in South Florida, having children with the basics of water safety can prevent unnecessary drownings, and it can help other children not being drowned because your kid knows how to swim to save them. Rear vehicle seats until 13 years old. That's a little bit new. Booster seats, they should be until they're 8 years old. Using equipment, bike helmets, if they're on any other things, wrist protectors, knee protectors, helmets, all of these things are important. Again, putting these kids, giving them procedures, always remember that kids like to know what's going on. So again, get on their level, get below them, get on developmental level, break open the ice, and then explain it to them, let them touch them, feel them, what's going on, and they do so much better. Now, because school age is ages 6 to 12, remember a 6-year-old will need some different explanations than would be a 12-year-old. So a 6-year-old having an x-ray, you might have to say, it's a camera. It's this big thing and it makes clicking noises, but you're not going to get any gamma radiation rays going through you. It's not going to hurt you. And I'm going to show you your insides when you come back. Remember, those little explanations are important. ADHD is a big thing in school age children. It's that distractibility. One of the things about having a child, especially school age, that has ADHD, and the teacher keeps sending them to the nurse's office because, they are just so disruptive and distractible and hyperactive and inattentive, all that stuff. Um, Send them to the school nurse so that we get the parents in, find out what's going on, what have they done. Many parents are at their ropes then, they've done everything. So as a school nurse, just make sure that you listen. They've probably tried everything, but you might have something else to help them. Depression in kids can happen in school age, can happen in adolescence. In depression, there's many things you might see. They might feel sad, hopeless, they don't want to do anything, go anywhere. They don't want to eat or they're eating too much. They're sleeping too much, they're not sleeping at all. All of these things could be depression. And any inkling or any mention of suicide, take it seriously. Dental health, they should brush before bedtime minimum. Of course, in the morning, we should do it all the time, but at least before bed, get them brushing. And flossing is important. Remember, children younger, first grade and younger, they don't have that dexterity to floss properly. So parents are going to have to help. And those soft bristles, loose teeth in school age children is normal, right? They're always losing teeth. So don't think that school age children with loose teeth, that means they have poor dental health. It just means they are losing their teeth and their minutes are coming in. As I said, chicken pox, what to look for, the temperature, papules, vesicles, that rash, itchy, and burn. And again, get that mask on you, that child in an isolation room. And remember, they can't go to school until everything is crusted over. Ray syndrome is due to aspirin and some metabolic with this child. It's usually after a viral condition, and they actually say influenza is one of those. Having influenza, taking aspirin can cause Ray syndrome. So adolescence is that identity. Who am I? They're difficult. They want to do what they want. Parents need to set limits and structures so they know what's expected and what their boundaries are. We know that it's looking for identity, and adolescents are all about body image. Who am I? What do I look like? Do I have too many pimples? My hair's too short, it's too curly, too red, too blonde, too whatever. Again, negative self-image can cause depression also. Leading cause of death of adolescents. Number one, always motor vehicle, but then it's the suicide, homicide. It is real. And they do think they're old enough now to touch dad's gun. and they go off and things happen. Nutrition. Adolescents tend to grab a bottle of water, a power bar, and go out for the day and don't eat all day long. And this can cause, many types of problems. Could be food disorders, eating orders. They restrict it because I'm too fat, because my body image, I don't feel good about myself. Um, One of the things with nutrition with adolescents understand is to get that again 24-hour food in um menu, like what did they eat, what happened there. STDs, which means, your sexually transmitted diseases and getting them. We know that one of the things that we give is Hep B and the HPV virus series. Remember, the HPV is 3 doses, and it's boys and girls, and it starts at around age 9. Again, this is to prevent um, cervical cancer, and it helps prevent HPV in boys and girls. Talking to adolescents can be hard. Again, open it up, talking about what music they're on, or I love the sneakers. Where'd you get those Nikes? I haven't seen them before. Or, I see that you're wearing a Mets shirt. Do you like the Mets or you like the Yankees? Again, building a rapport. And then, of course, maintain that confidentiality if we have parents leave the room to find out what exactly is going on. And as I said, sending those parents out of the room, talking with them, remember to allow them to express themselves. They're going to tell you some things that could shock you. Just sit there and listen, and find out what's going on so that we can help. We can, teens can get contraceptive, without parents. And again, we want that child to express themselves for sure. So adolescents, they're get up and go all day long, right? They're with their buddies and their friends, and they're in sports, they're in activities, and they're doing their homework because they need to get in that good school, and they're not sleeping. Oh, and then they got a new boyfriend, so they're texting and talking on the phone all night. So there is a lot of sleep deprivation in adolescence. And they're going through this big growth spurt. So they really do need their rest, but they tend not to. I've already talked about depression, suicide, and then Tanner stages of development. One of the things, infants become children who then becomes young adults, and they start developing into mature men and women. Now, the first thing that happens in a female is their breasts get little buds on it. The male is their testicles, their scrotum gets bigger. Those are the first 2 stages. And then it works from 1, which is nothing, and then it goes to 5, which is your absolutely mature female and male. Okay. They say, you start with these changes. Menstruation starts about 2 years after those first changes. And as we are the girls, it's very common in the very beginning to have irregular menstrual cycles, because remember what they do in the very beginning of their adolescence. They get that growth spurt, right? So they're gaining weight, gaining height, and then they have the irregular menstrual. Very, very common. And of course, all of these hormones are coming up. So they really are very moody. So you've got some dosage calculation stuff. It's here. I've sent you more stuff on your announcements. You've got them. You've got your Kahoots here. And that's your review for today. Any questions? Good luck to you all. I hope you do really well.
Thank you.
Have
And
a good day.
thank you.
Bye. Thank you
Thank
so
you.
much.
I have a question, Professor.